Good morning. My name is Alice Olawo, and I work with FHI 360 as a family planning technical advisor. My leadership project is titled I Decide What to Use, looking at whether Kenyan and Nigerian adolescent girls and young women feel empowered to make contraceptive use decisions. I focused on young women adolescents because of the challenges that they face, including early pregnancy, unsafe abortions, and sexual violence, among others that negatively impact their health. However, when they're impaired, they can express their childbearing desires and make independent decisions regarding their sexual relationships and use of contraception, leading them to a healthy life. Studies have shown, additionally, that there is a positive association between women's empowerment and contraceptive use, but this knowledge is still lacking when it comes to adolescent and young women. Therefore, my project set out to empower adolescent girls and young women on contraceptive choice, looking at the recommendations that I will make. I want to understand how adolescent girls and young women make contraceptive decisions related to use of contraceptive, including the hormonal IUD, and also just describe the factors that influence the decision-making and the exact role that these women play in the decision-making process. I've undertaken my project under the bigger FHI project of scaling up hormonal IUD in new and emerging markets being conducted in Kenya and Nigeria. We've worked in 64 public health facilities, 32 in Kenya and 32 in Nigeria, conducting and this involved conducting exit interviews with women who are aged 15 to 49 years who recently adopted the hormonal IUD. For my leadership project, my focus has been on adolescents and young women aged 18 to 24 years. Through this project, I've been able to work with a variety of stakeholders who've supported me through the process, mostly Ministry of Health, but also those who are implementing reproductive health programs for adolescents and young women. I've had protocol approvals at all levels, both ethical and programmatic, and we've been able to do exit interviews with over 2,000 women. Through this project, I've had opportunities that will enable me to contribute to improve programming for adolescent and young girls and young women through the recommendations I'll make, and also really networked with a broad range of stakeholders. Some of the challenges I've faced is the fact that I'm working with only a small subset of women, those who've adopted the hormonal IUD, and also just geographic limitation in terms of counties and states. The leadership project has shaped me in very many ways as a leader. I'm paying more attention to factors that influence my leadership and looking out for opportunities that I can leverage on. I'm purposeful in letting my voice heard. I'm tapping into underutilized influence styles to get things moving, such as inspiring and asserting. I'm beginning to appreciate conflict more and learning to provide direction through it and take firm positions where need be. I'm appreciating people for who they are and that each of them brings on board a unique contribution for the success of the project, and also appreciating change and looking to how to engage everyone else in the process so that change is successful. I've become more intentional in how my leadership is impacting others. For me, it's about doing my very best so that I can also get the very best out of others. Looking forward, the leadership project has enabled me to introspect more and see how my project can contribute to the bigger family planning agenda. And so I'll focus my disseminations and also recommendations and follow-up as appropriate and continue to build my network of allies and be a woman who makes a difference, not just at the workplace, but also in the community at large. Thank you for listening and for the opportunity.